So my grandmother, Abby, used to have a glass of wine every day, and she lived to be 97. My grandfather, Obel, a Scotch every day, lived to be 95. So how does drinking affect our health? Great question. Our insider, Dr. Andrew Forster, talks about serving sizes, moderation, and binge drinking. Take a look. First, let's take a look at what a standard drink looks like. I love these things. So, doctor, the amount depends on the type of alcohol, right?
Right. So each drink is different because some things like beer, as you see there, have less alcohol than a glass of wine or hard liquor. So even though it's more fluid, you're getting the same amount of alcohol per volume.
So in terms of beer, 12 ounces is considered okay?
Well, that's considered one alcoholic serving.
All right, 5 ounces of wine.
Right.
Doesn't seem like a lot, but okay, I'll take it. And look how they say red wine. Do you like red over white?
Red.
Red. And why so? They say it's better for your health?
It's supposed to be better for your heart.
Supposed to. I'm a Chardonnay girl. Is that okay?
That's fine.
All right. And then, of course, the hard liquor, which is 1.5 ounces. Once you go over, doctor, then what?
So there's what's called a healthy drink and non-healthy drink. So, 1 or 2 drinks a day is okay. Any more than that, you start to have more health effects that are not good for you.
Okay, and in fact, adding to that, doctor, according to the Centers for Disease Control and Prevention, 1 in 6 adults binge drink about 4 times a month. That's a lot of drinking. What's considered binge drinking?
So binge drinking is you're drinking enough to get legally drunk within 2 hours. So typically that's, for men, that's more than 5 drinks in 2 hours, or for women, more than 4 drinks, alcoholic drinks. So 4 beers or 4 glasses of wine within 2 hours.
And besides becoming drunk, obviously there are many negative effects associated with excessive drinking. We have a list of them. This one surprised me. High blood pressure.
Yeah, so alcohol in excess can cause inflammation in the body. So all these things, heart disease and strokes, are related to inflammation of the blood vessels. Then pancreatitis and liver disease. The alcohol is a toxin, and if you drink too much of it, you're going to cause problems with those organs. Can you refresh our memory as to what pancreatitis is, please? So pancreatitis is an inflammation of the pancreas. It's typically very serious. Even with today's modern medicine, it still has a relatively high fatality rate. And people who drink a lot go on to get chronic pancreatitis, which is they're in the hospital every few months with attacks of pancreatitis. The pancreatitis basically digests itself, and it's very uncomfortable and very serious.
The last one on the list was liver disease. What is the relationship between alcohol and the liver?
So when you drink alcohol, the alcohol gets degraded in your liver and turned into various other substances. So people who drink, that's a lot of work for the liver to do, and those people can go on to get cirrhosis and scarring of the liver.
It's like putting the liver on overdrive?
Right.
Okay. In addition to these effects on your health, drinking alcohol can also put you at an increased risk for certain cancers. The Center for Disease Control and Prevention has a short video that explains the relationship between alcohol and breast cancer. Take a look.
The latest estimate is about 40% of cancers are due to lifestyle factors that we have control over. Alcohol increases the risk of developing breast cancer. The reason that happens is because when it's metabolized in the body, or it's used in the body, it produces estrogen-like compounds, and exposure to estrogen is one of the things that can lead to breast cancer. One thing you can do to help lower your risk is drink less alcohol. That's 1 drink per day for women and 2 for men.
Let's quickly show you our phone number, toll-free number, in case you'd like to call in and ask the doctor a question or two. 855-796-4475. And not only does, alcohol affect our health, but, let's just also talk about the public's health in terms of the problems that we have with drinking and driving. It startles me with all the awareness, the campaigns, Mothers Against Drunk Drivers, and it's still 10,000
people a year.
And I don't even think the number has decreased.
Yeah, it's decreased a little bit, but there are some other issues with alcohol, increased rate with suicide and things like that. So people are definitely more aware of it, things like Uber. Actually, a lot of patients tell me they do Uber rather than drink and drive. So in one sense, that's a good thing, but it's still 10,000 people too many each year.
And I think there's more collaboration between people where they say, used to maybe not say, but now they say, listen, you know, you can't get behind the wheel.
Yeah.
And people are communicating that more.
Right, that and designated driver.
Is there a
sort of
certain
thing.
age group still that's prevalent in terms of binge drinking?
So adolescents and college age are the big groups where we see that.
Okay.
Yeah, very sad.
Very, very sad. And to explain more on the effect of binge drinking on college kids, we have a video featuring Dr. Nora Volko, the director of the National Institute on Drug Abuse. Take a look at this.
The drugs that are most frequently abused by college students are, number one, alcohol, and the rates of alcohol drinking are very high in college kids. Approximately 35% of them actually will be drunk in any one given month. When kids drink alcohol, it is not uncommon for them to mix them with other substances, and in particularly in college kids, what has become more of a fashion is to mix alcohol with energy drinks that have very, very high content of caffeine. And so this sort of counteracts a little bit the sedative effects, but can have very adverse physiological effects. And in some instances, it can actually be dangerous.
Doctor, I just want to follow up on that a little bit because I've heard that when you are drinking alcohol and then you want to kind of like wake up or have that moment of, you know, I'm okay now, and you couple it with an energy drink, what's happening to the body? What are the dangers? I can only imagine your heart rate just starts going.
Yeah, I mean, I usually tell people it's trying to drive your car and drive in reverse at the same time. Your heart and your brain and other parts of the body don't know which way you're going. You're putting a stimulant in the body and what we call a central nervous system depressant, so it's not good.
And moderate drinking, you hear that. Some people like to have a glass of wine every day. They say there are potential health benefits, true or false?
Probably true.
Okay,
yeah.
and what are they?
Probably a lower risk of heart disease, lower risk of depression, just overall better health. But it's unclear whether those people actually tend to be more health conscious anyway, and they may exercise more and not smoke, so unclear.
Oh, that's a good point.
So,
because I tend to have like a little glass of wine
yeah, that's fine.
every day.
Yep.
And my grandmother had a martini till she was 96 every day, but it was a very small one.
Okay.
God bless her, Abby. And she loved having her little martini till 96.
Right. So, yeah, alcohol in moderation is fine.
Okay. What's considered moderate drinking for, let's say, they tended to have different numbers for men and women.
Yeah, so men, it's usually 2 drinks a day, women 1 drink a day.
And why the difference is just the body makeup?
Right. Men tend to process alcohol slower. Women tend to be more slight of build, so they absorb alcohol faster and more parts of the body. So
All right.
for men, it's a little bit more.